Hello everyone, welcome to my channel. Today's lesson will focus on nursing management of hypoglycemia in clinical practice. We will look at the causes of hypoglycemia, signs and symptoms of hypoglycemia, and how to treat a patient who is experiencing hypoglycemia. This is of course an example of a clinical protocol, and so if you do require more in-depth knowledge, you may need to visit other sources. Hypoglycemia is also referred to as low blood sugar. Hypoglycemia happens when the level of glucose or sugar in your blood falls below a level that is necessary to adequately support your body's need for energy and stability of cells. The treatment protocol that we will be looking at will be applicable to patients who are 18 years and older and they have a blood glucose reading of less than 4 millimoles per liter as confirmed by POCT glucose meter or venous sample. Causes of hypoglycemia. For non-diabetic patients, some causes of hypoglycemia include certain medications such as beta blockers like atenolol, heart arrhythmia medications, metformin when they are used with sulfonylureas. Underlying illness, overproduction of insulin. Reactive hypoglycemia is a condition that is poorly understood and is associated with excessive insulin production. This typically happens within a few hours after eating a meal. Drinking alcohol. Alcohol interferes with the normal blood sugar regulation and can produce highs and lows that contribute to alcohol use disorders in some people. Hormonal deficiency. Aside from insulin, there are various hormones that impact glucose regulation. Insulin autoimmune syndrome. For patients with diabetes, they can experience hypoglycemia as a result of incorrect dosage of diabetic medications or insulin, lack of carbohydrates, exercising more than usual, delaying or skipping meals, not taking their medications regularly. Please remember, if the patient is diabetic and they are experiencing hypoglycemia and they are on an insulin pump, that the first thing you'll do is to stop that insulin infusion. Symptoms of hypoglycemia can be classified as either autonomic or neuroglycopenic. Autonomic symptoms are neurogenic symptoms that are the result of the perception of psychological changes caused by the autonomic nervous system in response to hypoglycemia. Neuroglycopenic symptoms, on the other hand, are signs and symptoms that result from the direct central nervous system deprivation of glucose. Autonomic symptoms include shaking, trembling, sweating, hunger, tingling, anxiety, palpitations, or nausea. Some neuroglycopenic symptoms include confusion, drowsiness, dizziness, vision changes, difficulty speaking or concentrating, weakness, headache, seizure, and this could also go on to coma. If the patient is awake and alert and their blood glucose is between 3 to 4 millimoles per liter, you will give 14 to 16 grams of fast-acting carbohydrate. Check their blood glucose in 15 minutes. If the blood glucose is still less than 4 millimoles per liter, repeat treatment with another 14 to 16 grams of fast-acting carbohydrate and informing the physician or nurse practitioner. If the patient is awake and alert and their blood glucose is less than 3 millimoles per liter, you will give 20 grams of fast-acting carbohydrate. Check blood glucose in 15 minutes. If it is that your blood glucose is still less than 3, you're going to repeat treatment with 20 grams of fast-acting carbohydrate and informing the physician. On the other hand, if their blood glucose is less than 4, you'll repeat treatment and instead give 14 to 16 grams of fast-acting carbohydrate and informing the physician. For the patient who is unconscious, combative, confused, or NPO, and their blood glucose is less than 4 mmol per liter. If the patient has an IV infusion, you will administer 50 ml bolus of 50% dextrose IV over 1 to 3 minutes. If the patient has a saline lock, you will administer 50 ml bolus of 50% dextrose IV over 1 to 3 minutes, and you will have to flush with NS after. You will also run normal saline at 30 ml per hour. If no IV access, you are unable to get a saline lock in the patient, you can administer glucagon 1 mg subcutaneously or intramuscular and initiate IV normal saline at 30 ml per hour, then convert this to a saline lock. You will need to recheck their blood glucose in 15 minutes. If at any point in time the patient becomes unconscious, you will need to stat page the physician. Dextrose Injection D50% is a hypertonic glucose solution that comes in 50 ml. The solution is very viscous, and so you will need a blunt fill needle to withdraw the medication from the vial. Some facilities do carry the pre-filled syringe. You will find this in your crash cart or the acute area of your emergency department. You will remove the caps from the vial and the injector. Insert the vial into the injector without excessive force, ensuring that the vial and the injector are properly aligned. Then you'll gently rotate clockwise until the medication enters the needle. The tip of the injector has a lower top, so you will be able to attach that to your saline lock. 14 to 16 grams of fast-acting carbohydrates. Your facility may carry Dextrose tabs in different flavors. You will be administering 4 tablets to be chewed or swallowed, or you may administer the Dextrose glucose liquid blast, which comes as 15 grams. You may also administer 114 ml of cranberry juice or 15 ml, which is 3 teaspoons of sugar and mixed in water. If the patient has a feeding tube, you can administer 15 ml of sugar mixed in 50 ml water. If the patient has dysphagia, you can give 3/4 cups of unsweetened applesauce. Here are some important considerations. If the blood glucose meter result does not match the presenting clinical symptoms of the patient, or the result is less than 2.5, you're going to immediately repeat that blood glucose meter, draw a venous sample, and treat it immediately. You will also need to notify the physician if more than one hypoglycemic event occurs within a 12-hour period. This may mean that their diabetes medication needs to be reassessed. Now, if the patient will not have a meal within 1 hour after fast-acting carbohydrate given, you will need to give the patient a snack. This snack can be 4 to 6 crackers with cheese and some juice. If the patient will not have a meal within 1 hour after fast-acting carbohydrate given and the patient is receiving feeding tubes, you will need to contact the physician for reassessment of tube feeds. Nursing documentation. Your role as the nurse will be to document in the healthcare record the assessment that you completed, the interventions, your evaluation of these interventions, the sequence of events, and when it is that you notified the physician. You will also need to record blood glucose readings. Now, there are facilities that do have machines that will auto-populate. You will also need to record medications administered on the medication administration record. Please remember that D50% is a medication, so you will need to sign this off. You can also document any carbohydrate or food that you gave in the activities of daily living section in your healthcare record. Please remember to provide patient education. Also reflect on the reason the patient may have experienced hypoglycemia and take steps to prevent future episodes. As a nurse, you may need to discuss medication optimization with the physician, or the care plan needs to be reviewed. The physician may adjust the medication or readjust targets or readjust monitoring orders. Thanks for joining us today.